Hello, I'm Dr. Yambai. I am the new endocrinologist at Advocate Roman. Today we're going to talk a little bit about the thyroid gland and what it means to have thyroid problems. First of all, it's important to know that the thyroid gland is located in the front part of your neck, and it's a very important gland because it regulates your metabolism, which means that it regulates your energy levels and the way your cells work within your body. So it's a very important, thyroid hormones are very important for your general health. They help the brain cells, the muscle cells, the heart cells, and the bone cells work well. What kind of problems can happen? Well, the thyroid, if it doesn't work well, you can have a condition called hypothyroidism, which means that your thyroid gland is underactive or not working appropriately because the thyroid hormone levels are not meeting the needs of your body. And what happens when you have hypothyroidism or underactive thyroid? You can have many symptoms. There's no one particular symptom that goes along with this clinical condition, but you can start noticing some dry skin, some issues with your hair, especially the hair loss. You can notice that you're a little more sluggish, that things are, concentration is getting a little bit worse, and your mood fluctuates a little bit more. You can notice a little bit of weight gain. Usually we're talking about 10 pounds, and the weight gain, we're talking about weight that it's not related to poor eating habits. Now, what happens if you feel symptoms that are related to being overactive, and that's called hyperthyroidism. And other synonyms for this are commonly known are Graves' disease. So if you've ever heard that term, that's something that is associated with overactive thyroid function or hyperthyroidism. And the symptoms are exactly the opposite as the underactive thyroid, and you're going to start feeling a little more jittery, may have problems sleeping or falling asleep, may notice that your heart is racing unusually when you're not exercising, just when you're sitting around and doing nothing that is exerting yourself. Also, you can notice that you're sweating all the time, or not in any particular time of the day, but you may notice more sweating, and also may notice that you're shaking a little bit more, and may find yourself a little bit winded. And you can also actually be noticing that your energy levels fluctuate. You may feel tired even though your heart is racing and your metabolism is wrapped up with the excess thyroid hormones. Now, what are the other thyroid conditions that can be related to not being overactive or underactive? Thyroid nodules are very common in the population, and what do nodules mean? It just means that it's an extra growth within your thyroid gland. Usually, most of them are benign, which means that they're just growing because they just tend to grow, and they don't cause any clinical problems or any issues. But it's wise enough if you feel a lump in your neck area, or if your doctor feels that you have something unusual in your neck, that needs to be followed up with obviously thyroid hormone testing through the blood or a thyroid ultrasound to look for those nodules to see what they contain, because there is a very small risk that you can have thyroid cancer. And the risk is very small. It's usually 5% of the population, and it doesn't matter if you have many nodules as if you have one, because the risk is the same. So you shouldn't worry if you have a ton of nodules versus just one. It's more what it's defined in the ultrasound, and the doctor will explain that to you if that is the issue. And the other thing to remember is for the females, if they have thyroid problems, things might change when they get pregnant, and you need to make sure that you alert your doctor when you get pregnant. If you're taking thyroid hormone medications, or if you're told that you have hyperthyroidism, you need to be seen right away because medications or the therapy can be different.